I am Dr. Naushad. I am from India actually, but I am living and working in Moscow last 22 years. I was invited by a government organization, semi-government organization to Russia, Moscow, for treating the Chernobyl patients. Of course, before that, I finished my Ayurveda Medical College in India, in state of Kerala. It is in South India. And I think somebody in this hall know about Ayurveda. If somebody heard about it and somebody know about it, please lift your hand. Yeah, only very few heard about Ayurveda. The same thing happened when I was in Moscow in 1996. So we have very difficult patient on that time because they are the liquidators of Chernobyl atomic accident. It occurred in 1986. I came to Moscow to treat them 10 years later in 1996. So the treatment has good effect because it was good support from Russian Ministry of Health, and we completely launched full project on that treatment. So all these things or the results are published in some medical journals, and also we have so many internal and international conferences. We also went to Italy, Cyprus, and Germany. These places we made the lectures. About more than 1 billion people is using the help of Ayurveda to treat and treat the difficult diseases or maintaining their health. I know there is an association for Ayurveda in Bulgaria also. I know one lady is the president of that association, and she is active in most of the Ayurvedic conferences. In all over Europe, especially it is most popular in Germany, in UK, and in USA also it is very popular. What is Ayurveda? It is a massage therapy, something concerned to spa. Is it yoga therapy? Is it a wellness therapy? Or it is a curative therapy? So answer is the old. Everything is Ayurveda. Because Ayurveda, so many massages are in Ayurveda. It is not only mere massage, it is usually therapeutic massage. So Ayurveda uses yoga to help the people to maintain their harmony, bodily harmony, pranic harmony usually says, the energy flow. And yoga has immense effect on curative effect. And it's a wellness therapy also because so many resorts also have a part of Ayurveda, a part of their wellness section, Ayurveda, in most of all over the world, because it according to economy, it is economical also. So in my state, I am from South Indian state, Kerala. It says the heaven of Ayurveda, so many Ayurveda specialists, so many health resorts, which is completely full, and so many hospitals, which is completely full round the year. So it is also a wellness therapy, and it is a curative therapy also, because Ayurveda is a complete alternative medicine. Ayurveda is a science of complete health. So the question from the correspondent from your university is, Ayurveda is very ancient. How it could be help the modern people? The same question was with me when I was come to Russia to treat the Chernobyl patients, because you see the atomic disaster is a modern problem. It is man-made modern problem. Ayurveda is very ancient. How can Ayurveda can cure this ancient science? How it can cure the modern problems? So you see, in Ayurveda, all the things we are taking into heart, by the shlokas. Shlokas are the song. We starting to study Ayurveda from song. For example, the definition of Ayurveda in health, I can just see it is a Sanskrit word. It is a Sanskrit 2 lines. Samadosha samagnischa samadadu malakriya prasanna atma indriya manaha sosta ityabhidiyate. Sosta means the healthy person. That is the same definition according to WHO, but WHO, World Health Organization, done it only in 1970s. In Almaty Declaration, they find this definition in 1972. But Ayurveda has the same definition 5,000 years before Christ. So that means we come to Ayurveda by knowing the health definition according to Ayurveda. We come to that. Samadosha means dosha is the factors, which is the physiological factors which governing our body, all the functional factors which is governing our body, our health and disease, everything. That is the balance of the healthy physiological factors. Samagni means the balance of Agni or all the metabolical factors. Samadhatu means the balance of the body health tissues, including our biochemical factors is in our body. And the Samamalakriyā means the excretory functions, the balance of excretory function. These all balance, and prasanna means clear. Atma is the soul, Indriya is our sensory faculties, and Mana is the mind. You see, this is the health definition of Ayurveda, with all the physiological and structural factors in balance, and with a clear mind, soul, and sensory faculties. The World Health Organization, the health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is the health definition by WHO. So Ayurveda very ancient, and by even the definition you can see it is very modern. So we can say Ayurveda is not a simple medical science. It is difficult to study. In Ayurveda Institute, we are taking 5 years to study the Ayurveda. It is a complete medical institute. It is difficult to get admission also in Ayurveda Institute, because for one seat in government medical Ayurveda college, about 400 people for the entrance examination. So, and its study also is not simple, because I will give some simple concept of Ayurveda, then I can say how it come to the practical. It is also very difficult to imbibe, but Ayurveda makes a lot of things simple in practice. But to understand it is difficult, but when you understand it is easy to apply. So it is not only intended for diagnosing and treating diseases alone. It is intended for treating and diagnosing the diseases, but it has more range. It is a way of life. It is a science of true living, a wisdom which reaches the true and high human potential. So Ayurveda started in Vedic period. I already told you the Vedas are the asset of human knowledge. So this is in Vedas, all the philosophy, science, everything is included in ancient time. So in Ayurveda also, the medical science, Atharva Veda is the fourth Veda. Veda started when Aryas came to India. The knowledge was there, and they started to compile and written in Sanskrit language. Sanskrit language is the very ancient. I think only one language is before Sanskrit was Tamil, and Sanskrit is very ancient and is the mother of all Indo-European languages. For example, when I came to Russia, I heard a lot of Russian words like in Sanskrit. For example, Agon, they say Agni. That is the same as fire. Yeah, so many words. And I think in Bulgarian language also so many words in Sanskrit. Ayurveda is considered as the fifth Veda because it is complete science. There is the influence of some rituals there, but mostly it is described about the human body, the artery, vein, and the human cells. Everything is described on that time in Ayurveda. So Ayurveda says it is universal science. So we just think, you see, everything is made up of 5 elements. Then we started to, we laugh about it. According to modern science, there is 118 elements. 94 of them is in earth, and 24 of them is synthetically made, and 80 of them has isotopes. And because it may after a period of decay, it changed to another elements. These elements are the concept. You see, I can tell you, I may write these things, because in every atom there is the 5 elements. It is the concept. It is everywhere in our chemical and physical elements. For example, we may take an atom. In atom has the nucleus and is the atomic mass. Atomic mass, the earth is the concept of mass. So the earth is the mass. So this is the earth. Most of the atomic mass made up of the nucleus. Then there are electrons, orbits, which is going, because there are negative and positive energies. The energy is the fire. Even it is small atom, the electrons are revolving in the orbit. There is the motion inside an atom. You see the atomic bombs made up of fission and fusion. So big energy from an atom. The 3 is from there. So it is not we say everything is made up of these 5 elements. You see, this 118 elements also included in these 5 elements. This is the concept. And it is not the water is not only the water which is here very nearby. You have the Black Sea. It is the water in that. It is predominantly in that water. So water is the cohesion. If there is positive and negative energy, there is a cohesion force. It is binding force. This binding force is the water. It is not the water itself. Of course, in water, there is more water. And in water also, all 5 elements. And then next one, I already said the energy, all the motion is the air. And even it is small atom, it needs a space. Then the atom binds molecule, and the molecule make the gross things. By the binding of molecules, make the gross things. Yeah. So the space is we can say the sky. That is the Panchabhuta theory. Panchabhuta means 5 elements. Pancha in Sanskrit 5. Buddha means in Russian is Sushnas. That means what is have. We have. Yeah, that means 5 elements. So there are so many Ayurvedic theories about the made up universe. It is coming from Big Bang. It is very close to Big Bang theory. So we are not going to that because we have only 4 hours. I want to give something about it. And it is very, you see, it is very primitive, but it is very conceptual. So why we are saying about Panchabhuta? Because we are treating the people. So in Ayurveda, there are so many other treatment. Veterinary, there was separate treatment for horse, Ashwa Ayurveda, special treatment for the elephants, Hasti Ayurveda. So many different branches are there. But now why we are treating the people who are made up of Panchabhuta, or the 5 elements, and we are taking any things from the universe, from the nature, that is also Panchabhuta. And we are correcting the balance. So I can say everything is made of Panchabhuta. All the person in this whole are made up of Panchabhuta. I am made up of Panchabhuta. Everything, this whole, even this thing is made up of Panchabhuta. It is only the difference is the composition and the predominance, which is predominant. For example, this is, you see the hollow. This is less earth. This more earth, just more air. Because a lot of hollow, this sponge inside it. And the composition is different in every thing. And in every people, the composition is different. You see, the criminalists can find a culprit by find our fingerprint. Just like every person in this is different, it is personal. So that also we come to the individualization of the treatment in Ayurveda, because we want to know the composition. So it is very difficult to find water, earth, fire, wind, sky in a person. So Ayurveda made it more functional, and from that made 3 dosha theory. 3 dosha is the 3 principles. 3 principles is the physiological principles and bodily principle. So why Ayurveda made it? Because to simplify the Panchabhuta theory, it is very vague and very vast to find the composition of 5 elements in a body. So we made it more simple. According to Ayurveda, there are 3 factors. That is, Vata is the principle of movement. You see, it is made up of air and sky, or ether and air. And the Pitta is the principle of digestion, absorption, assimilation, and transformation. That is the digestion and metabolism. All the transformation go through the Pitta. Pitta, you see, mainly with 2 opposite factors that I will come to you. Pitta, that is the fire and water. How fire and water can coexist? Can you say one example? Can you say one example? Fire and water coexist. I think everybody knows that. In Russia, I say always the example vodka. Because you can spirit, yeah? You can just fire it. You can just put a match and it can get fire, yeah? So this is the all of our digestive, what we say is digestive juices, or all the metabolic and ferments means enzymes, is usually in liquid state, but it has the quality of digestion and transformation. That is why we are saying pitta like that. And you see, kapha is the principle of nutrition, bonding, cohesiveness, and growth. So you already in theme, you can say what is made up of kapha. Without, I think from the, I would like to hear it from the auditorium. Can you say what made up of kapha? I say Vada is made up of ether or sky and wind. Ether, this is space and air. Pitta is made up of water and fire. And kapha, how it is made up of? It is made up of earth and water. Because the mass, all the body what we are seeing is kapha, most of them. For example, the muscles, of course, in bones there are so many hollows, it is some vata and mainly also kapha. These structures are usually made up of kapha. So we can see from a macrocosm, the universe, we are come to the microcosm. That is why from the 5-element theory, it is a physical application, and it is come to the biological application, and it is come to the functional and biological application through this theory. And all this pharmacology, everything is dependent upon this. Then Ayurveda is studying very deeply the quality and properties of these elements, and qualities and properties of the biological elements, that means biological factors, Vata, Pitta and Kapha. All the diseases and the health is defined by Ayurveda, by this theory. So you see, it is a very complex, but it is also simple when you are coming to if you studies in first year, second year, we are just studying the theories. From the third year, we have the patients here, the clinics, and we are starting to study the constitution. There are so many questions we can say about Ayurveda. I already these things. Dosha is the Vata, Pitta, Kapha. We are saying it as one terminology, dosha. The same thing, Vata, motional energy, and chemical energy, and solid substratum. Dosha is the dynamic group of body function, because all the Vata, Pitta, Kapha is dosha. Dhatu is a complete component of body structure. This is the structural factor. There are 7 dhatus. Dhatu are 7 in number. Ayurveda is always simplifying, because in our body there are a lot of tissues, and histology is a special, special branch. There are special histologists, and it's a special medical branch due to the reductionist approach of the modern medicine. This is the dhatu, is the component of body structure. Mala is the toxic and unwholesome byproduct. That is our metabolic wastes, mala. So we need all these factors in body. We need dosha because it is the lively factors. Because of that we are living. And dhatu is the structure body, our muscles, our bones, our, you see, the internal organs, all the things are, and our blood, lymph, everything is the dhatu. And mala is the toxic substances, the gross toxic excretory substances like our stool, urine, yeah, and sweating also. And moreover that, there are a lot of metabolic waste. We understand that if some metabolic waste is high in body, it is very hazardous for the body. For example, acetone, yeah, it is very hazardous for body. So these, but in small quantities, it is needed also for body. For example, I am just saying, if there is a dysentery, the stool completely gone, the person with dehydration goes to hospital also, because it is also needed in a particular form in our body. So the next thing is the Agni. Agni is the literally means it is the fire. This is the metabolic factors. The Agni is all the metabolic factors in our body. The digestive, when we eat the food digests, and then it goes through the dhatus. In Ayurveda, there are so many dhatu Agni also. There are tissue metabolic, also there are transformation in between the tissues going on. And tissues, I will give you the term, I think it will be there. And the Srotas, all the network of channels is acted site and continue the transformation. For example, there are so many channels in our body. Mainly the transformation between the tissues is going through the Srotas or the channels. And there are some more other channels. I will give you the, we can look our case sheet, how we take the history of the, how we consult a patient. I can show you then what are the Srotas we are going through. And we are putting the problems in the dosha, that means the 3 factors, dhatu, the 7 factors, mala, which is increased in our body, and which transforming factor, which metabolic factor, transforming factor is affected, where it affected, and what is the cause of that, and which Srotas or the channel which going through these metabolites or our nutrition factors is closed. For example, in Ayurveda, not only the Srotas, not only our body thing, and even we have mind, we have some says Manovaha Srotas, what our throat flowing channels also. If throat flowing channels is blocked, so many psychological, maybe psychiatric disease arises. So these are the 7 dhatus. Dosha, I already given you what is dosha. These are the 7 dhatus. So 7 dhatus, according to Ayurveda, the first one is Rasa. Rasa, we can say the primary nutritious fluid. Somebody says it is lymph, somebody says it as blood, part of blood. Of course, Rasa is when I just tell you in Ayurveda there are 7 dhatus. It is also made for the simplifying and to understand the disease. Rasa is when we eat the food, it digests in the stomach and going through the duodenum to the small intestine. And the first nutritious thing is digested from the small intestine. It takes only the essence what they need from the food it is already absorbed through the villi. It is known as, we can say it is as rasa. Of course, it is mixed with blood, lymph, everything, but according to Ayurveda, it is the rasa. So there are so many symptoms described. How the rasa vaha, what is the canal channel of rasa is deranged, have problem. We can understand by symptoms. And the next one is rekta. Rekta literally means the blood, but it is not the blood itself as we see the red blood. So it is also the blood too, because rekta has the definition, what which gives life, because all the nutritious products and the oxygen is supplied through the blood. That is the second tissue. In Ayurveda, it is tissue, the second tissue. The third one is the mamsa. Mamsa is the tissue. Usually we can say it is the muscular tissue, all the muscular tissue and some of the ligaments, but ligament is the, we can come to the other tissue. You see, you can say ligaments and tendons in between the asthi and mamsa. Medas means the, we can say the fatty tissue. Adipose, it is not only adipose tissue, but it can say the, even in cells, it may be in Golgi bodies. In Golgi bodies, it produces lipids also. And lipid layer of the cell, also medas. We can see one of the, we say one of the problem usually occurs in heart disease. It is the hypercholesteremia. Hypercholesteremia is the one of the problem of the medas tissue. Of course, somebody has the metabolic syndrome. Yeah, metabolic syndrome is the, that is the, we can see the obesity and associated problems. Yeah, hypertension, hypercholesteremia, and then again it act, because the medas, its base is kidney, and it also affect the kidneys, and the, you can see it also affect all the other part of body, and blood sugar also come. One of the disease, blood sugar. And the next one is the asthi. Asthi is the bone what we support. So there are some tissues in between these things. For example, I already say you, between muscles and bones, there are ligaments, fascia. I think a lot of kinesiologists are sitting here. Some of the kinesiologists, I heard some kinesiologists is with us. So the muscles and bones are very, there are some products in between that. That is the tendons and ligaments. And the majja is the, what in between the, that is the bone marrow, inside the bone. It is not only the marrow, and it can, one of the biggest bone marrow according to Ayurveda is the brain. It is not a marrow, but inside the, it is also in Ayurveda, it is the majja. And the shukla is the, literally means it is semen, but it is the reproductive factor. You say all these tissues, when you see, we say about the 5 elements, we have a laughter, yeah, but it is only a concept. This also concept, but all the tissues are very completely described by their properties, and what are the channels in between them is completely also described, and what is the problems occurs and what is the health sign also described in Ayurveda. So this is the seventh dhatu, and we can come to the Prakriti, and after that we are go through these things. I will give you the separate time, not go through that, because what is Prakriti? From the Prakriti in Sanskrit word is a vast thing. It is Prakriti means nature. Priroda in Russian. I don't know what is in Bulgarian language. That is the nature. Same. Priroda. Yes. So this is the nature. Nature, how it occurs, it is genetically determined. It is the terminology, the definition. It is genetically determined relative proportions of doshas within the normal range. Why we are again come to dosha? Because everybody in every Ayurvedist says dosha, dosha. So many patients coming to me in Moscow, even they are somebody coming from even Europe. They know what is their doshas. Most of them taken their doshas from the internet, because there are so many questionnaires for that. But they are not sure, and they come to me to know their Prakriti. Constitution is very important. I will give given the questionnaire. It is the determined from by the father and mother. It is by the X and Y chromosomes or coming to there, and it define the you see the sex of the person. Yeah, it is defining in the inside the uterus in itself. And what it can be changed, the mental state of mother, what is the social situation she faces, what is the food she eats, what is the ecology. It can be also influence this Prakriti. So all these things is genetically determined, and now there is a big studies in India and going the genetic mapping of the person, and to see what are their doshas. So this is very important to know the health of the person. And so health status, it is very important to know the health status. It is very important to know the disease susceptibility, which disease can be come in future for that person. And it is in preventive and promotive health care, very important in preventive promotive, because we know who is that, which disease can be come to his. And the next one, of course, the treatment. It is all over the Europe now. There is a medicine known as PPP medicine. There are 3P medicine or 4P medicines. P means one is preventive, promotive, predictive, and personalized. That is 3P. This is the PPP medicine. One Dr. Olga, she is in Germany, is the president, and one person from Italy is the vice president of this organization. And they have good movement all over the Europe. So many doctors, dentists, and even some paramedical staffs, specialities also in this movement. It is a very good moment. We can say it is completely Ayurveda because they are always inviting also to us, because if you know the Prakriti means the constitution. This is the same thing. You know, that is 1P is preventive, how to prevent. Then the first P you can say even predictive. Then predictive, you can predict it, which disease can be occur for him. Yeah. That is the predictive. Then third one is promotive. How to make promotion of the health. And of course the last P is personalized. I know some of the practicing doctors are in this hall. They are also suffers with the, I think in Bulgaria is the also the insurance medicine, insurance, yeah, medical insurance. Yes, yes. So everything dictated by the insurance. Even one doctor want to write one individualized medicine for the patient. Maybe it is not in the standard schedule. If it is not, they cannot write, because it may be a legal issue for them again. So this personalized, okay. So personalized medicine is always suffering now, even by the law. Before that, maybe doctors have more freedom. Now doctors has less freedom, because everything dictated by the insurance. So this movement is started from the Germany itself, because they are suffering, they are very compact. So now for the, if you need a person need a very personalized help, I already told you every person is different, as like the fingerprints, and the doshas and dhadus, everything I told you is different and individual in him.